Dr. Beda, can you tell us the difference of a veneer and a lumineer? It's a term confusing to many of us because it really, on the surface, looks like the same thing. It's kind of a clip-on fingernail, as I call it, on your tooth, of course. They tell us, people, say Lumineers, veneers. What are we talking about?
Well, I think a lot of times, Helmut, that those terms are used interchangeably. So let's take a look at what a veneer is. A veneer is a facing on something by definition. So your description of kind of like a fake fingernail, although it's not a fake fingernail, fairly accurate in there, fairly accurate. A lumineer is basically a brand name for a special type of veneer that's put on a tooth that's very, very thin and can be used for the aesthetics of the tooth. Lumineers are usually used on teeth that require none to very, very little preparation. Veneers a lot of times
preparation, you mean grinding down, right?
But yes, exactly. Shaping the tooth or grinding it down. A lot of times when you're doing a case in Lumineers, you don't have to touch the teeth at all because they are that thin. Regular veneers can be, and by regular veneers, once again, we're talking about something that is a facing on the teeth, like an artificial fingernail. A regular veneer can be a little bit thicker, and I think that term is mostly applied to teeth that have had some shaping on there. You're shaping, and now you're re-putting a whole different facing on the tooth that can be a little bit thicker, and that's what a veneer is normally referred to. But I've seen them used interchangeably. Once again, the great part about Lumineers is a lot of times they can be done to slightly shape the tooth, go in and change the color of a tooth and that sort of thing without ever having to change the tooth.
Right, I see. But if you put that lumineer on it without kind of decreasing the size of the tooth first by grinding it down, no matter what, that tooth is going to become a little bit bigger because no matter how thin that veneer is, or maybe not, maybe it is so paper thin that you don't see it, but it still, so looks to me it's difficult to then just do one tooth with a veneer in front because it may outproportion the other teeth or not.
Right. Right. Doing any type of cosmetic work just really requires an eye for what's going to match and what's going to do. Although it's possible to do a single tooth, and there are circumstances where you can. If you're trying to alter some shape and shade and appearance of teeth, try to do one that's a little bit rough. That's I guess like going to a bowling alley and have one red bowling pin in there amongst the others. You're going to spot that pretty easily. So get the idea that you want to make sure that as they're done in the proper series, that when you look at them, that they're going to blend in and do well.
I see. So basically, for all purpose, it's the same. It makes your tooth look good with a clip-on, a ceramic something. One is pre-made by a company, and then they make them very thin. So if the teeth doesn't have to be scratched, then that would be kind of good, and then it can be used. Right. And the other one is a little more flexible because you're already grinding the tooth down anyway, so you can then arrange it more, I guess, the way you want it.
Precisely, exactly. You got it.
All right. But for all purpose, we as patients just shouldn't worry what it is. The dentist will know which one to put on.
Oh, exactly. And patients should ask questions on, well, what's going to look best on me? You probably wouldn't
know what you have. If you look at the person, first of all, if you guys do a good job, which, dentists do, the average person, except a dentist totally trained in it, would never know that the guy has veneers, fake teeth.
Oh, right.
Yeah. Right. So at the same token, he wouldn't know, even if I then tell my friend and said, oh yeah, they're all veneers, Lumineers, there wouldn't be a difference as such, right?
Yeah, exactly. They will look great. If done properly, it's going to look good.
In terms of lasting, is there any type of difference between those two or not really?
I don't see any difference between the two. Both of them are porcelain products, and if done and placed properly and bonded properly, you're going to get the same longevity out of them.
All right. Okay. Thanks a lot again, Dr. Bella.
You're welcome.